Welcome to the Deep Dive. Today, we are tackling a really serious topic in animal health. Canine distemper. It's one of those diseases that feels like it should be gone, you know? We have vaccines.
Yeah, but it's surprisingly persistent and honestly pretty devastating when it hits. It's complex.
It really is. And that's why we're doing this deep dive. We've got some great source material here, really comprehensive. Our plan is to use this to unpack what canine distemper actually is.
How it spreads, how it attacks the body.
Exactly. And what it looks like. The signs can be super confusing.
Definitely. And then how vets diagnose it and crucially how we prevent it. That's the big one.
Right. We want to give you, the listener, a clear picture, sort of cut through the jargon.
Let's get straight to what matters.
Okay, so let's dive in. Canine distemper. What are we fundamentally talking about here?
Okay, so at its core, it's a virus, highly contagious. The bug itself is called canine distemper virus, or CDV.
CDV. Got it.
And here's something interesting. It's a paramyxovirus. That means it's actually, believe it or not, related to the virus that causes measles in humans.
Wait, really? Measles? I had no idea there was a connection. Does that mean anything practically?
Well, it's mostly about their structure and how they behave genetically. They target similar systems, maybe, but they cause very different diseases in dogs versus people, obviously.
Okay. And the canine part, is it only dogs?
No, that's a common misconception. This source makes it really clear it hits a whole range of carnivores. We're talking foxes, wolves, raccoons, ferrets.
Ferrets too, wow.
Yep, mink. Even big cats like lions and tigers can get it. So wildlife reservoirs are a huge factor.
Which makes eradication basically impossible, I guess.
Pretty much, and this isn't like a minor cold. The source stresses it's a major threat.
Aggressive, high mortality.
Especially in unvaccinated animals, yeah. The mortality rate can be really high.
Yeah.
And a big reason is that it doesn't just hit one spot, it attacks multiple body systems.
Like which ones?
Respiratory, the lungs, airways, gastrointestinal, the stomach, intestines, and the one everyone dreads, the central nervous system, brain and spinal cord.
Oof. So it's a full-on assault.
Yeah.
And you're saying it's still common, even with vaccines?
Unfortunately, yes. It's still prevalent, particularly in places with low vaccination rates or, in shelters or stray populations where it can spread easily.
Okay, that's bleak. So how does it actually spread? How does an animal catch it?
The number one way is through the air, aerosol droplets. So an infected dog coughs or sneezes.
And another dog nearby breathes it, and like us catching a cold.
Exactly like that mechanism, yeah. But obviously much more serious consequences. It can also spread if animals share things like food bowls, water bowls, toys, anything contaminated with secretions.
But the virus doesn't last forever outside the body, right?
Right. Thankfully, it's not super hardy in the environment. Things like heat, sunlight, and most common disinfectants, bleach is a good one, kill it pretty effectively. It doesn't survive for long periods out there.
Good to know. Okay, so it gets breathed in or maybe ingested. What happens next inside the body? Where does it go first?
So first, it sets up shop in the lymphatic tissue near where it entered, usually the respiratory tract. Think tonsils, lymph nodes in the chest. It starts replicating there.
Multiplying.
Right. And from those initial sites, it breaks out into the bloodstream. That's a stage called viremia, literally. Virus in the blood.
Okay, so it's using the blood like a highway system.
Exactly. And that allows it to travel all over the body and reach those target organs. We talked about the lungs, the gut, the skin, the eyes, and eventually the nervous system.
And how sick the dog gets depends on their immune system.
Absolutely critical, yeah. If a dog has a strong immune response, maybe they're well vaccinated or older with a mature immune system, they might fight it off quite well.
So they might just get mild signs or maybe none.
Could be. Subclinical infections happen. But if it's a young puppy whose immune system isn't fully developed yet, or an unvaccinated adult dog, or one that's immunocompromised for other reasons,
then the virus runs wild.
Pretty much. It replicates much more freely, causes way more damage, and that leads to the severe, often fatal forms of the disease.
Which brings us to spotting it. The source says it's, notoriously difficult to diagnose early on. Why is that?
Well, mainly because the symptoms are all over the place. They vary hugely from dog to dog. They change as the illness progresses. And crucially, they look a lot like other more common things.
Like what kind of things? What are the first signs you might see?
Often it starts with a fever. Sometimes it's this weird biphasic fever, goes up, down, then up again.
Oh, okay.
And almost always you get discharge from the eyes and nose, not just watery, usually thick, kind of yellowish or greenish goo.
Okay.
The dog will be tired, lethargic, just off. They won't want to eat. That's anorexia. And you'll often see coughing and sneezing.
Which sounds exactly like kennel cough or just a bad cold.
Precisely. That's why it's so easy to miss early on or misdiagnose. Then, as it moves on, you often get the GI signs.
Stomach and intestines.
Yep. Vomiting, pretty bad diarrhea. And because they're losing fluids from both ends, dehydration can happen really fast. That's a major concern.
Okay. And then the neurological signs, those sound like the worst part. When do they usually show up?
They often come later, sometimes weeks after the first signs, maybe even when the dogs seem to be getting a bit better from the respiratory stuff. It happens as the virus invades the central nervous system.
And what does that look like?
It can be varied. You might see muscle twitching. Sometimes it's called chewing gum fits, if it's the jaw muscles, or just twitches in the legs. That's called myoclonus.
Little spasms.
Yeah, involuntary. Then you can get full-blown seizures, could be localized, just one part of the body, or generalized, affecting the whole body. Dogs might become uncoordinated, wobbly when they walk. That's ataxia.
Difficulty moving.
Right. Or a head tilt, eyes flickering back and forth rapidly. That's nystagmus. And in the really severe cases, you can see weakness progressing to partial or even complete paralysis.
That's terrifying. Is there anything like a unique sign, something that screams distemper?
There is one thing that's pretty characteristic, though not every dog gets it. It's called hyperkeratosis, or hard pad disease.
Hard pad.
Yeah, the paw pads and sometimes the nose leather become really thick, dry, and hard, almost crusty. It's caused by the virus messing with skin cell production. If you see that along with other signs, distemper is very high on the list.
But not all dogs get it, you said.
No, definitely not. So you can't rule out distemper just because the pads look normal. You might also see skin rashes or little pustules, especially on younger pups.
Okay, so given this mess of symptoms that can look like anything, how do vets actually nail the diagnosis?
Yeah, it's definitely a puzzle. It takes putting together a few different pieces, the clinical signs they see, the dog's history, and then specific lab tests are usually needed to confirm it.
What's key in the history?
Vaccination status is huge. Is the dog vaccinated? Up to date? Age is important. Those young puppies, 3 to 6 months old, are the most vulnerable. And exposure risk. Has the dog been to a shelter recently? Boarding kennel? Around stray dogs? And then seeing those more suggestive signs, the thick inos discharge, any neurological issues, maybe the hard pads that raises the suspicion level way up.
Okay, suspicion is high. What tests can confirm it?
There are a few options. PCR testing is probably the most common go-to now.
PCR, like for COVID.
Sort of, yeah. It looks for the virus's genetic material, its RNA. It's very sensitive, very specific. They can run PCR in blood or on cerebrospinal fluid.
The fluid around the brain and spine.
Exactly. You need a spinal tap for that, so usually only if there are neurological signs. Or they can test swabs from the eyes or nose where the virus sheds.
So it directly detects the virus.
But there are other tests. Yep. ELISA tests can look for viral proteins, antigens, or sometimes for the antibodies the dog's body makes against the virus, again, in blood or CSF. There's also fluorescent antibody testing, which uses special antibodies that glow under a microscope if they attach to the virus in tissue samples, like from an eye swab.
Any general tests that help, like regular blood work.
Sometimes. A complete blood count, a CBC, might show a really low white blood cell count, particularly lymphocytes. That's called lymphopenia.
And that means?
It suggests the immune system is being suppressed, which the distemper virus definitely does. It makes the dog vulnerable. If there's coughing, chest x-rays might show signs of pneumonia. And that CSF analysis we mentioned can show inflammation if the brain is involved. It's often about building a case with multiple bits of evidence.
Okay, so you've got a diagnosis. How do you treat this thing? Is there a cure?
This is the really tough part. There's currently no specific drug that kills the canine distemper virus itself once a dog is infected. No magic bullet antiviral.
None at all. Wow. So what do you do then?
Treatment is all about support. It's entirely supportive care in managing the symptoms. You're essentially trying to keep the dog alive and as comfortable as possible, giving their own immune system the best chance to fight back.
What does that support look like in practice?
A huge part is fluids, preventing or correcting dehydration from the vomiting and diarrhea. So IV fluids or fluids under the skin, giving drugs to control the vomiting, maybe the diarrhea, though you have to be careful with antidiarrheals.
Right.
And nutrition is vital, getting them to eat, maybe tempting them, or if they absolutely won't eat, sometimes a feeding tube is necessary to get calories in.
You mentioned the immune system gets suppressed.
Yeah.
Does that cause other problems?
Yes, big time. Secondary bacterial infections are super common and very dangerous, especially bacterial pneumonia.
Ah, so that's where antibiotics come in.
Yeah.
Not for the virus, but for these other bacteria.
Exactly. Antibiotics are absolutely crucial to fight off those secondary infections that take advantage of the weakened immune system, usually broad-spectrum ones that cover a range of bacteria.
Okay. What about managing those awful neurological signs, the seizures and twitching?
That's incredibly challenging. For seizures, you use anticonvulsant drugs like phenobarbital or diazepam to try and stop or reduce them. For the twitching, the myoclonus, there isn't really a specific treatment that works well, unfortunately.
So it's mostly controlling the seizures.
Controlling seizures and then just really intensive nursing care. If a dog is weak, paralyzed, having seizures, they need round-the-clock attention to keep them clean, turn them, help them eat and drink, prevent bed sores. It's a lot.
And isolation, I assume.
Oh, absolutely essential.
Done.
Strict isolation to prevent spreading it to any other susceptible animals. And meticulous hygiene, disinfecting everything the dog touches. Bowls, bedding, the floor, your hands.
You said bleach works.
Bleach dilutions, yeah, and many standard veterinary disinfectants work well. Thankfully, the virus doesn't survive long on surfaces if you clean properly.
Okay. So with all this supportive care,
Yeah.
what's the outlook? What's the prognosis?
It really, really varies. If it's a milder case, maybe the dog had some previous immunity, they might pull through with good supportive care and have a decent outcome. But if the dog develops severe neurological signs, the prognosis becomes much worse. Guarded to poor is the typical veterinary term. Sadly, many dogs with severe neurosigns either don't survive or the damage is so profound that euthanasia is considered the kindest option.
That's heartbreaking. And even for the ones that do survive.
That's the other kicker. Even the survivors, especially those who had neurological involvement, can be left with permanent problems.
Like what?
Lifelong seizures that need constant medication, persistent muscle twitches, the myoclonus, sometimes blindness, weakness, coordination problems, or even significant behavioral changes. Recovery isn't always complete.
Man, this just underscores how vital prevention must be.
Absolutely, 100%. Vaccination is, without a doubt, the most effective weapon we have against canine distemper. Full stop.
So what's the standard vaccine protocol look like?
For puppies, it's a series. They usually start around 6 to 8 weeks old. The reason for the series is because of antibodies they get from their mother's milk, which can interfere with the vaccine early on.
So they need multiple shots.
Yes, boosters are given every 3 to 4 weeks until the puppy is at least 16 weeks old, sometimes even 20 weeks, depending on the vet's assessment of risk. This ensures they build their own solid immunity as the mom's antibodies fade.
Crucial to finish the whole series then.
Absolutely essential.
Yeah.
And it doesn't stop there. Adult dogs need regular boosters too. How often depends a bit on the vaccine type and local regulations, but typically every 1 to 3 years to maintain protection.
Keep that immunity topped up.
Exactly.
Besides vaccines, anything else owners should do?
Well, common sense helps. Avoid letting your dog have close contact with unvaccinated dogs or wildlife, especially if you don't know their health status. If you bring a new dog into your home, especially from a shelter or unknown background, keeping them separate for a bit quarantine is a good idea.
Just to be safe.
Right. And honestly, just talking about it, making sure fellow pet owners understand why vaccination is so important. It protects not just your own dog, but helps build community immunity.
Herd immunity for dogs, basically.
Sort of, yeah.
Wow. Okay. So wrapping this up, this deep dive really shows canine distemper is, it's no joke. Highly contagious virus related to measles hits multiple body systems.
No specific cure. Treatment is all supportive care, which is intensive and expensive.
And the outcomes can be really variable, sometimes leaving permanent damage, even if the dog survives.
Which all points back to prevention. Vaccination is just paramount. It's still one of the most challenging infectious diseases vets face.
It really is. And brings up a final thought, something for you, the listener, to maybe chew on. We've had an effective vaccine against distemper for a long, long time now. Decades.
A really good vaccine, too.
Right. Yet this disease is still a significant threat globally, not just in dogs, but in wildlife, too. What does that reality tell us?
It tells us that having the medical tool, the vaccine, isn't the whole story, is it? It points to challenges in access to veterinary care, maybe cost, public education about why ongoing vaccination matters.
How we manage stray animal populations, the interface between domestic animals and wildlife. It's not just a virus problem.
Exactly. It's a bitter picture, a societal puzzle in a way, layered on top of the medical one.
Definitely something to think about. Thanks for joining us for this deep dive.